The escalating measles outbreak in Texas and New Mexico is not only claiming lives. A second death, an unvaccinated adult, was reported on Thursday, but also crippling pharmacies, leaving them struggling to meet the surging demand for the MMR vaccine. The situation paints a stark picture of a public health crisis fueled by both a highly contagious virus and the insidious spread of vaccine misinformation. As the number of confirmed measles cases climbs, 198 in Texas with 23 hospitalizations and 1 death, and 30 in New Mexico with 1 death. Pharmacies in major Texas cities, like Austin, are facing significant shortages. While appointments for the MMR vaccine might still be bookable at Walgreens locations, pharmacists are reporting consistent stockouts across the city. This scarcity reflects a desperate scramble to protect the public from a preventable disease. The experience of Anne and Paul Clancy, who recently visited a Walgreens in Austin to inquire about the MMR vaccine, underscores the widespread problem. Their simple request highlights the growing anxiety and the increasingly difficult reality faced by those seeking protection. The ease of booking an appointment is deceptive. The crucial vaccine is often unavailable. The scene unfolds across Texas, mirroring a larger national struggle against misinformation and disease. Williamson County, encompassing a portion of Austin, boasted a relatively high MMR vaccination rate of 94.87% among kindergartners in 2023, according to the Texas Department of Health and Human Services. This statistic, however, offers little solace in the face of the current crisis. The outbreak demonstrates the inherent vulnerability even within communities with high vaccination rates, underscoring the necessity of widespread vaccination to achieve herd immunity. The situation is further complicated by the actions of prominent figures actively spreading vaccine misinformation. Robert F. Kennedy, Jr., a high-profile anti-vaccine activist, while acknowledging the importance of vaccines, has subtly undermined public trust, framing vaccination as a personal choice rather than a public health imperative. In a recent op-ed, Kennedy downplayed the lethality of measles, drawing comparisons to 19th-century mortality rates, a tactic that strategically ignores the advancements in modern medicine and the devastating impact of the disease in the unvaccinated. This deliberate distortion of facts is actively endangering lives and exacerbating the crisis. The Centers for Disease Control and Prevention, CDC, is currently investigating the repeatedly debunked link between vaccines and autism, a claim persistently pushed by anti-vaccine advocates. This ongoing investigation, while necessary, is overshadowed by the urgent reality of the current outbreak. The CDC's Friday Health Alert, urging providers to remain vigilant and highlighting the crucial role of MMR vaccination, serves as a stark reminder of the consequences of inaction. The severity of measles shouldn't be underestimated. This highly contagious disease is not merely an inconvenience, it's a serious threat with potentially fatal consequences. Furthermore, measles can induce immune amnesia, a condition where the immune system essentially forgets past infections and vaccinations, leaving individuals vulnerable to a wider range of illnesses. The combination of the virus's inherent dangers and the erosion of public trust in vaccination creates a perfect storm, pushing the healthcare system to its limits. The current crisis is a stark reminder of the devastating consequences of both disease and misinformation. It emphasizes the critical need for accurate, accessible information and the imperative for widespread vaccination to protect communities from preventable diseases. The shortage of MMR vaccines in Texas isn't just a logistical problem. It's a symptom of a deeper societal failure to combat the deliberate spread of disinformation and the resulting erosion of public health. The urgent need for action is undeniable, and the lives at stake demand immediate and decisive intervention. This is not just about vaccines, it's about safeguarding public health and confronting the deliberate undermining of trust in vital medical advancements. The consequences of inaction are far too grave to ignore.